think this video is probably going to be the most unethical video I've ever made. But the reason why I'm making it is because I met a few patients recently with a very similar story. Some of these men that I've seen recently who said to me, look, I knew I had obstructive sleep apnea. I knew that there was something seriously going on, but I was too scared to tell anyone about it, to get investigated, to get treatment, because I was worried that if I was diagnosed with obstructive sleep apnea, I would lose my job. These are sort of people who need their car and they want to drive, and they're worried that the DVLA will take away their license. Operating heavy machinery, all those sorts of people who, if they have obstructive sleep apnea, they can't work. And if they can't work, they can't pay the rent, they can't pay the mortgage, their wife and kids will be destitute, and the things that go through people's minds really worries them. I completely get that, because as men, we're designed to provide and protect for our families, even at the detriment of our own bodies and health. And we will do anything that's needed to make sure that the people who depend on us get what they need. And that's our sort of job, and that's our meaning in life. Now, aside from the fact that you're risking your own life and the lives of others whilst driving or operating heavy machinery, there is the fact that a lot of people just use the DVLA rules that state that if you have obstructive sleep apnea, you also need to be excessively tired for them to take away your license. So if you look at the Epworth score, and I'll stick that here somewhere, if you do the Epworth score and you're not so tired, a lot of people say, well, I've got sleep apnea. I'm not very tired, therefore I can carry on driving. I mean, that's not true. And the DVLA have got it wrong here. And I think a lot of people know this instinctively as well. If you are, I think a study was done many years ago, I think in Spain, where they looked at all these drivers who had had a car accident and did sleep studies on them, and found that the people with obstructive sleep apnea, most of them said, I'm not tired. I can drive. Every time I drive, okay, I do get tired at the end of the day, but every time I drive, I'm wide awake. It's not about being tired. It's about your vigilance levels, which are dropped when you have obstructive sleep apnea. But I think, as the rules state, if you're excessively tired, and that's based on normally the Epworth score, then officially you're allowed to drive. It doesn't make sense. I mean, I think it's wrong, but that's beside the point. And I know people out there who are listening to this will think to themselves, I'm still not going to sort of dob myself in and lose my job over what some guy on YouTube is saying. So the reason I'm making this video, and reason why I think it's unethical, is that I'm going to tell you how you can deal with your sleep apnea and get yourself normal again as much as possible. And then you can go to your GP and get within the guidelines. You're basically sorted with your obstructive sleep apnea, but you still need treatment. So I'll go through them one by one. Now, the first thing is, I think you really ought to unblock your nose. A lot of people watching this will say, I can breathe with my nose fine. What are you talking about? But a lot of people, and in fact, most people with obstructive sleep apnea actually have a blocked nose and don't even realize it. They've just got used to carrying on. Men sort of just get on with life. They know that they have to go to work and they've got a slightly blocked nose. They just breathe through their mouth. It doesn't seem to bother them too much. But if you sniff like this and sniff like this, particularly in the middle of the night, if you wake up, or first thing in the morning before you get up, if you sniff like this and sniff like this, you'll notice a lot of people with obstructive sleep apnea will have a blocked nose. So unblock your nose. It doesn't fix the sleep apnea, but it will help you. The idea is to improve the quality of your sleep and your quality of life, so you're not so tired during the day. And it also helps with other problems, other treatments for obstructive sleep apnea. So just do as I say. Unblock your nose. Sometimes people use nasal dilators that sort of open up their nose like this. So if you push your nose open like this and breathe in, you'll be able to feel like, oh, actually, I can breathe a bit better. And you'll see, Robbie Fowler, footballers, and other people wearing these breathe right strips, open their nose. You can wear a mute thing that goes into your nose and opens up your nose. In fact, I'll put my videos here so you can see them as I make them, as I talk about them, should I say. And you can go to these videos and you can get more information about any of the things I talk about in this video. So there's the nasal dilators that open up your nose. You can also go to your pharmacist and say, look, I've got a bit of a blocked nose. Can you give me a spray? And there are loads of sprays. There's salt water sprays, completely harmless. Make sure it's a congestion salt water, really salty water. When you spray it up your nose, it unblocks your nose for a short time, but it may be useful for you, particularly when you're trying to sleep at night. You can go to your GP and not mention that you have obstructive sleep apnea, again, unethically, but You can get your nose unblocked with steroid sprays. In fact, sometimes you can get these steroid sprays over the counter as well. And there's some videos on that as well on my YouTube channel. Just be careful that sometimes you can't use steroid sprays, people with eye problems, glaucoma and things like that. So do speak to a doctor about it beforehand. The next thing I think you ought to do is sleep on your side. I've done some research into this. Approximately 60, 70% of people are almost sorted out in terms of their obstructive sleep apnea when they sleep on your side. That's why your wives are rolling you over onto your side when you start snoring in the middle of the night or if you stop breathing, because they know that your airways opened up more, you snore less, you have less blockages of your airway. So sleeping on your side makes a big difference. If you think that you sleep on your side the whole night long, if you look at sleep studies, most people sleep at least 20% of the time on their back, and that can disturb their dream sleep and other types of problems and give them obstructive sleep apnea. So to be absolutely sure that you're sleeping on your side the whole night, wear a woody nose backpack or a slumber bump, or I think it's called Zoma. There's all sorts of devices out there, which is like a strap around your chest or a backpack that you wear at night. It looks a bit ridiculous, but you're forcing yourself to sleep on your side so that basically the tongue doesn't fall back and block your breathing. You're rolling out the way. I've even got my own pillow, which is somewhere over there, which helps you sleep on your side as well. But it's only useful if you find sleeping with these other devices, which are only about 20 to 40 pounds. So it doesn't cost very much. These other devices that force you to sleep on your side, sometimes they cause, your arm goes numb or your neck hurts or your shoulder hurts or your hip hurts. That's the only reason to buy my pillow. But most people can get like a woody nose backpack and things like that that forces them to sleep on their side, and that lets your tongue roll out the way so you're not keeping yourself blocked up in the middle of the night. It lets gravity to open up your airway. So sleep on your side. Up to, I think it was like 60 something percent of people no longer had sleep apnea when they slept on the side. Even though I think about 80 something percent of people had at least a 20% improvement in their sleep apnea when they slept on their side. And I talk about the recovery position, and I'll put some videos up here as well, which explains that in more detail. There are also some exercises you can do for your tongue and your throat. And these are exercises designed to sort of tone up the muscles in your throat so they don't keep sort of collapsing in like that. There's pretty good data for it. Some people say at least about 50% improvement in your snoring and sleep apnea. And it's a bunch of sort of tongue exercises and tightening up exercises. There'll be more videos I'll stick up here for you to look at that. And these exercises you need to do for about half an hour a day for about 3 weeks before you start noticing the difference. So keep doing those exercises. Do them whilst driving on the motorway, because that's the most risky time as a sleep apnea patient. The sleep apnea patients seem to cause the most fatal crashes on the motorway because it's a boring drive. And people tend to fall asleep going at high speed and causing a fatal crash. So try and avoid that. I think there's some stats say that it's about 12 times more likely to have a crash as a sleep apnea patient, even though they don't feel very tired. And even though they think, I'm fine when I'm driving. I'm banging on about that driving thing, but I'm just scared for people out there. So do these exercises half an hour a day for about 3 weeks. You'll start noticing the benefits because you're tightening up your throat, stopping it from collapsing in. These next few things are rather boring and a bit of a killjoy, but I've got to tell you anyway, go to bed early. Because if you're not getting good sleep, and you know you're not getting good sleep, go to bed a little bit earlier. Because if you're not getting good quality of sleep, you might as well get good quantity of sleep. And if you're stressed, you tend to get a slightly more sleep apnea. You tend to fall asleep a bit more deeply and your airway blocks over again. And then the next day, you're even more tired. So try and go to bed early, get more hours of sleep, even though they're bad hours. At least it's better than having a short number of hours, if that makes sense. In the same vein, try and avoid coffee as much as possible, caffeine, Red Bull, all those sorts of things. Because again, coffee stays in your system for up to 14 hours. So, if you're going to start drinking coffee, just drink it first thing in the morning and then don't drink it for the rest of the day, because otherwise you're not really helping yourself. People get into this alcohol sort of caffeine cycle that my friend told me about. They drink loads of coffee in the morning and during the day, and they're sort of wired by the end of the night, and then they end up drinking alcohol to get themselves to sleep at night. It's a horrible situation because it gets worse and worse and worse. It's like a vicious cycle. Try and avoid doing that. Get more sleep, and then you won't need the coffee so much in the day. I can't stand the whole idea of drugging yourself. It's the most abused drug in the world, I think. But I know every American will hate me for saying that, and all the tea drinkers and coffee drinkers will hate me for saying that. But it's true. It's a drug, and a lot of people abuse it. So try not to drink coffee because it can disturb your sleep, irritate your sleep. So take it first thing in the morning if you really have to, but don't use it later on in the day. It really makes a problem for use. I understand that if you're driving, you need to keep it going. But I mean, I still don't think you should be using it anyway. In the same vein, I guess, smoking, not great. You know that you're not sleeping well and your breathing's not great at night. Are you really gonna smoke and damage your lungs at the same time? Anyway, I'm not gonna labour that point. It does also, damage your nose, make your nose a bit more blocked up, including vaping and things like that. So try and get off the nicotine as much as possible. And I appreciate I'm not being your best friend at the moment, but you've got to do it if you want to be able to drive, keep your job, look after your family and things like that. Now, I guess you could easily go to your dentist and say to them, "Look, I think I snore quite a lot, and I was wondering, my wife's really annoyed with me. Is there any chance that you can give me one of these sort of mandible advancement devices? These are the things that bring your jaw forward, and they look a bit like this. I've done a video on it as well. And these mandible advancement devices pull your jaw forward and therefore pull your tongue forward as well. It pulls on your palate as well, and therefore you stop snoring quite so loudly because it gets a bit tighter. It doesn't sort of flap around so much. But these are the things that help obstructive sleep apnea. It takes a few months to get used to this thing, but as you do it, it pulls your jaw forward and it becomes a little bit easier for you to breathe because you're able to breathe behind your tongue, doesn't keep falling back. Remember, you're sleeping on your side anyway, and that's going to help as well. But it just tightens up the whole area so that you don't have obstructive sleep apnea. It's really good for obstructive sleep apnea. There is another device which is less expensive than these things called a tongue retaining device. It's about 10 or 20 pounds. It doesn't cost very much at all. And there's about a 52% reduction in obstructive sleep apnea with these things. It looks ridiculous. And there's a video here. It pulls your tongue out of your mouth, sticking like this out of your mouth the whole night. It's like a suction cap. It's not very comfortable. I don't really think it's a long-term solution. But if it's pulling your tongue out of your mouth and you're not snoring so much and you're probably feeling better in the morning, even though the tip of your tongue can get a bit numb if you pull it out too much. Remember, you don't have to pull it out too much, just enough that it's sticking just a little bit out of your mouth. That's all we need. Up to the front of your teeth is fine, but it sort of pulls your tongue straight out. If you can manage that for the whole night, it tends to make your obstructive sleep apnea better. So use it. Use it. Anything you can do to improve your airway, improve your ability to sleep at night makes a difference. Some people, when they sleep on their side, sort of curl up into a little ball like this. And if you can imagine this sort of angle, trying to breathe around that angle isn't great for sleep apnea. What you're really trying to do is breathe like this. If you look at your kids who may be snoring, they sort of sleep like this because they're trying to get as much air into their throat as possible. And it's a bit like the sort of sword swallowing position like this. If you sleep like this, and a lot of people do that in the sort of fetal position when they sleep in their side, you sort of have to breathe around a corner. There are things called cervical collars that sort of open up your airway, help you sleep in a slightly more extended position. That seems to help quite a lot in some people. Again, a very cheap device. You can get it over from Amazon, like most of these things are, and that will help. There's also another thing called an EPAP device. It's a little sort of thing that you put up your nose, and it allows you to breathe in, but you find it harder to breathe out of your nose. It seems a bit counterintuitive, but it does seem to open up your airway slightly by giving you. It only works when you can breathe through your nose, and there's lots of caveats to it, but it does help. And there's some videos about it on my YouTube channel. So look at that as a different option. Now, all of these things you can get over the internet, and you spend a little bit of money, you feel like you're doing something. But a lot of people with obstructive sleep apnea are overweight. And in the old days, we used to think that, oh, it's because you got sleep apnea because you gained the weight. It's not true. Most people who are overweight with obstructive sleep apnea is because the sleep apnea caused them to gain weight. Another video on it there. It's the other way around of what most people think. And losing weight will not cure your sleep apnea, but it will make a significant difference. So if you're overweight, and I mean you need to be a BMI of at least 23, if you're Asian or some ethnic background, you need to be below 23. So go for a BMI of 23 and bring your weight down as much as possible. Remember, you're trying to look after your family, you're trying to keep your job, and you don't want to die, and you want to make sure that you can sort this out. As a man, you've just got to do your thing. You know you're going to have to push through this and lose the weight anyway. And I don't care how you do it. You can do, intermittent fasting, which is just a fancy way of not eating as much as before, or eating properly, healthily, and just reducing carbs. I love sugar. So there's lots of different ways. You know instinctively what the problem is. Just reduce the amount of food that you or calories that you're taking in and lose the weight. It's going to be really, really hard because remember, the sleep apnea is making you gain the weight back up again. But if you're not going to get treatment, then it's going to be really hard. Typically, what we do is we bring people in, give them treatment for their sleep apnea, and the weight just slowly falls off over about 9 months. In fact, I saw someone just a few days ago who said exactly that same thing. They gained weight straight after their tonsillectomy operation, but then they've noticed the weight slowly drifting off over the next 6 months because that's what happens when you lose sleep, when you reduce your sleep apnea. The reason why you have this weight gain in the first place is starting to ebb away, and so does your weight just naturally fall off even without the diet. But if you have sleep apnea and you know that you've got a problem and you know that you're overweight, losing the weight will improve your sleep apnea by about 30 to 40%. And it's worth doing that purely for that reason, just to bring your weight down. Aim for a BMI of 23. And don't tell me, well, I'm all muscle, therefore, I can't lose any more fat. It's about BMI. It's not about fat. So, these people in muscle gyms, those bodybuilders of 5% body fat, they can see the cut and all that sort of stuff. 80% of those people have sleep apnea. And if you talk to bodybuilders, and I see a lot of bodybuilders with obstructive sleep apnea, they know that when they push their body to extremes, they're going to get extreme results. Just don't kid yourself. If you're a big guy, you need to bring your BMI down to a normal level, 23 or below. And it's really hard work. And I'm not saying it's easy, but if you don't want treatment, you're putting other people's lives at risk and your own life at risk, just do something about it. Be a man and get on with it. Lose the weight. And it's the only way, I think, to do it in a morally correct way. Because once you've done all these things, and I agree, there's all this paraphernalia in your neck and in your nose and all this tongue sticking out and something around your teeth and sleeping on your side with the big backpack on. It's a lot to do, all these exercises you have to do. But what you're trying to do is bring your sleep apnea down by yourself. So you don't have to wear that CPAP mask. And I know there are people out there who will go, I don't drive for a living and I don't want any of these things, but I don't want to get a diagnosis because they're going to slap one of these things on my face and I don't want that. That's fine. That's fine. You don't have to have a CPAP mask if you really don't want to. See me, I'm an ENT surgeon. All I do all day is treat people with obstructive sleep apnea, do surgery on their throat so they can sleep without it. I don't think it's the right thing to do, but I think you should try CPAP at least, and you might feel great. You lose your weight, and all these things will be easier. But anyway, you don't neglect yourself for your own health just so because you're not worried about wearing a CPAP mask. There are other options out there, like the things I just told you about. There are 43 different operations I do for obstructive sleep apnea. If you really want to go down that route, I don't think it's an easier route. I don't think it's a nicer route, but there are options out there. So what I would do is get one of those sleep trackers or, like the Apple thing or SnoreLab. I've done a collaboration with SnoreLab and Jules at SnoreLab that I think I've given away a token or a flyer or something with each of my pillows recently. So that's quite useful, sort of knowing how loud your snoring is, and it's slowly improving with time. I've also got some questionnaires that you can follow up so you can sort of see how well you're doing. how I think the first thing is called a stamp score, which I invented, and it sort of tells you how well you're doing as time goes on. And all of these scores, all these sleep trackers, how loud your snoring is, will tell you if you're feeling better, if you're getting better. Your wife will tell you if you're breathing better at night as well. But I guess if you're going to go down this route, which I don't agree with, I think you should get yourself treated early on and then avoid all this happening in the first place where you're risking your job and the lives of other people. But if you're in this situation, you really don't want to have any of this treatment. What I would do is do all the things I just told you about, lose the weight, do all these exercises and everything, bring your sleep apnea down as low as possible, and then get a sleep study. So speak to me or some other sleep doctor, get a sleep study with all this stuff on. When you think that, yeah, I'm as good as I possibly can be, my sleep trackers say I'm doing well, my wife says I'm doing well, I'm going to wear all this stuff and prove to people that I don't have sleep apnea or very minimal sleep problems when I'm having treatment, because that's what the DVLA want to know. They want to know that when you are being treated, like if you wore a CPAP mask for 3 months, you can show that it's working for you, DVLA will let you drive. So the same sort of thing. If you're wearing all this stuff and you don't have sleep apnea on a sleep study, then you can say to the DVLA, "Oh, when I'm on treatment, I'm fine." The Then what you should do is say, "Well, can I try a sleep study without all this stuff to see how bad I am?" And then you can go down the route of getting treated, CPAP, mandibular advancement device, all those other things, surgery if you really want to, all those other things that you can do to treat your obstructive sleep apnea. As I said, I think this is completely unethical, but I don't want to lose all those people out there. You should get seen by a doctor and all that because I know people won't listen to me. And I've seen so many people recently with that same story. And I guess the economy is not great at the moment and everyone's scared about their jobs and their livelihood. And I know it's scary, but don't be in a situation where you leave your family without, a provider or someone to protect them. So don't be silly. Just get it sorted out. I'm not saying see me. You can see me on the NHS. You can see anyone. Actually, centres are opening up everywhere. Remember, there are these implants that are now opening up everywhere. You can get this implant in your chest or underneath your chin that will stop your obstructive sleep apnea. You can use CPAP. There's all these other operations I told you about. So don't think that that is the only option and you're stuck like this for the rest of your life. And I'm an old man now, and there's all sorts of psychology, like bad psychology, when it comes to obstructive sleep apnea. It's not a taboo subject. We should be talking about it. And if you look at, there's loads of people out there who do a much better job of communicating this to you. So please don't stick your head in the sand and allow your health to slowly deteriorate. Remember, life expectancy of someone with obstructive sleep apnea is approximately 58 years in the UK. It causes you to have high blood pressure. It causes you to have infertility. It causes you to have diabetes, weight gain, which I told you about, heart attacks, strokes. All these things go on. It causes depression. It's a cyclical relationship with depression. Depression causes sleep apnea causes depression. If you really care for your family, you're going to do the weight loss. You're going to do it. I know it's going to be much harder than normal people to lose your weight and exercise and all those things and wear this ridiculous stuff on your back. But just do it for the people that you've promised that you would look after. Um, I feel terrible making this video. Anyway, if you're not in that situation, get yourself checked out. If you have the slightest hint that you think you've got obstructive sleep apnea, it's so much easier to fix sleep apnea before it becomes really severe because trying to drag all this stuff back is so much harder. I'll stop talking now. Do take care. Thank you very much. Bye-bye.